the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back, everybody. Dr. Laura Wilson of Sherwood Family Medical Center joins us today, and we're going to talk about sleep hazards, especially in the nursery, especially new parents, but really all parents need to think about this, right?
Right.
Yeah.
And I wanted to call this hidden sleep hazards because I think most of us are aware of the general recommendations to try and prevent SIDS or sudden infant death syndrome, but there's a few other little things I thought we could include on this.
Okay, let's get started.
The first one I want to start with is the sleep devices or bedding that is marketed for infant sleep. And I'm sure a lot of moms, new moms, pregnant moms have seen these things. These would include like a DACA tot, recently a Rock and Play, which has actually been recalled, boppy pillows. So on the boxes of these things are often going to have a little sleeping infant looking so peaceful.
Yeah.
You may find down in the corner a little asterisk that says these are not intended for infant sleep. And that's because they go against the basic SIDS recommendations or SIDS prevention recommendations, which is for a baby to sleep on his or her back in their own crib or bassinet on a flat, firm mattress.
Right.
So anything that kind of cubbies up around the baby or has soft padding around it is going to go against those recommendations. And parents in clinic are floored every day when I talk about those really aren't recommended. Well, they look like they're for sleep.
Right.
No, they're really not. Maybe a casual nap right at your feet while you're watching TV, maybe, but certainly not in the thick of night when everybody's sleeping soundly.
Yeah, the packaging does not really tell you what it is really for.
It's very deceiving.
Yeah,
right.
it can be. Okay, what's next?
The next one is bumper pads or soft bedding. And so again, I still see these out at the stores, these big packaged crib sets with the fluffy bumper pads that new moms are so excited about because they're so pretty and make the nursery look so pretty. They're not really recommended.
No.
And that also is because the softness, the padding in that crib, baby could get their little airway, their little mouth up against those little pads and suffocate, which we do think may be part of the reason SIDS happens.
Okay.
Anything that is soft blankets, stuffed animals, all of that, we want out of the crib. The other thing with the bumper pads, of course, we think of it as a SIDS risk in the babies, but as they get a little older babies and toddlers, they can actually use it as a little step to climb out of the crib.
Yeah.
So more reason not to have these things in the crib, even as the child gets older.
It's got a little ledge there, sort of. And those little feet can
and they're
get up
pretty
there.
creative, kind of bunching stuff up.
And the stuffed animals and all that looks cute in pictures, but it's not for when they're sleeping.
Right, and I see pictures on Facebook and such all the time with all this stuff in the crib, and it just takes everything out of me.
To not message immediately, get that stuff out of the crib. Okay, what's next?
Another thing that parents may not think about are cords, and one thing that's really kind of gone out is those blind cords that have a loop in them. If you'll notice these days, most of the blind cords are actually two separate pulls, and that's because certainly those ones with a loop would present a strangulation hazard.
Okay.
So we want to have, if we can, those blinds that have two pulls, but even beyond that, of course, you don't want the crib next to those kind of pulls, right? Babies could still somehow get their neck wrapped up in one, an arm or a leg. In addition, just any electrical cords or any kind of, lamps or little gadgets in the room, we want to keep that far away from the crib so baby can't grab that cord and pull.
Okay.
And one thing I wanted to mention on this same topic is necklaces or baby jewelry. I am not a fan in general, but especially in sleep. I see the babies with the amber necklaces all the time, and I know the parents love them. Those are supposed to be for teething.
Okay.
I don't know if you've seen those.
Yes, I have.
But those really have no proven benefit for teething, and I do think they're a risk. Of course, there's a strangulation risk if somehow baby got it wrapped around their neck and around something else.
Right.
But those may be designed to kind of pull apart easily, so that's the the argument that they're not a strangulation risk. But then I worry if they pull apart, then baby's going to get one of those in their mouth and choke. So I'm not a huge fan of those.
Not a big fan. I've seen some that mom is supposed to wear. What do you think about those?
I think those are okay because, of course, that's not a strangulation for baby if mama's right there. I think they're kind of cute and funny where baby chews on them, but no jewelry on baby in the bed for sure.
Very good. Okay, and then anything else?
And lastly, I want to talk about overheating or over-wrapping clothing your baby. So we know to prevent SIDS or sudden infant death syndrome, or to help reduce risk for SIDS, I should say, we want to keep the house cool. So it's recommended maybe 68, 70, 72. I think a lot of families think, oh, we got a new baby, we need to warm it up. They're so cold.
Keep him or her warm.
Right, but actually a little cooler is better. We want to avoid a lot of excessive clothing layers on the baby. So the general rule of thumb is the baby may need one more layer than the parent does. So in this time of the summer, it's pretty hot. So baby probably could just have on a little onesie and maybe a light sleep sack. That's good enough. They don't need fleece and hats and all that kind of stuff. And again, just keeping the house kind of at a cooler setting may help reduce some of our SIDS risk.
They say that's good for us as well, so the whole family will sleep better.
That's right. The recommendation for everybody is sleeping at like 60 to 68 degrees.
I've seen that
which
recently.
Is so cold.
Yeah, we don't.
Peter Braves over there giving it.
He's like, I love it. But for sure for babies. You
Oh,
said
right.
about 68 to 72
Yep, I
in
think
there,
so.
and they don't need a whole lot on, right?
That's right, that's
okay.
right.
Thank you.
You're
Let's put
welcome.
up the information, of course, about Dr. Wilson and Sherwood Family Medical Center, of course, over there in Sherwood, and give them a call if you have any questions. Flu shots yet?
No,
Not
I
yet.
wish. I wish. We're supposed to get them
Okay.
in about a week, but
Okay.
we're getting close.
Getting close. It'll be about time to go in and get those.
That's right.
Thank you,
Thank
Dr.
you.
Laura.